Tuesday, October 21st. I'm Adam Walsh, and this is The Signal. And we are coming to you live from the Signal Hill campus for Memorial University. We're at a long COVID symposium, so we're going to talk about lived experience, research, the latest, the medical system when it comes to long COVID. So much to talk about through the full 5-5 of this show today. And as we start, I'll get you to introduce yourself.
Sure. Thank you so much, Adam, for having us today on this show. I am Dr. Ira Maniz. I'm a general internist, and I'm involved with the caring for people with living with long COVID and long COVID research and education here in St. John's in Newfoundland. I just wanted to highlight that long COVID has been long neglected. And about 400 million people worldwide have been estimated to have long COVID. And that is quite an underestimate because many people don't get formally tested,
so they don't know.
Yeah. And the doctors don't know to diagnose them. And as of the latest Statistics Canada survey, as of 2023, 1 in 9 Canadians have had long COVID. And many of these people actually do not recover fully. Hundreds of thousands have missed work and have not been able to go back to work. And 7 out of 10 Canadians who had the long COVID had it on a daily or a near daily basis. And there is a lot of social, emotional, and economic cost. Just as of the data presented only last year, the cost was estimated to be $1 trillion US.
Right.
And just the data that's coming out this month, it's estimated the US cost alone for long COVID is about $3.7 trillion.
So Dr. Maniz, you're my main, what I call my anchor guest for the show. And for everyone listening, if we sound a little muffled, it's because, well, we're at a long COVID symposium, so we're wearing face masks, and but I think everyone can hear us just fine on the air today. Simple question for you, for the Coles Notes or Reader's Digest, to date myself, version. What's the simple definition of long COVID? Because everyone knows what COVID is. I think people, they might know an essence of long COVID, but perhaps not. So what is long COVID?
So thank you very much for that question. So long COVID is an infection-associated condition. People who get COVID, if Health Canada defines long COVID as if you do get COVID and still have persisting symptoms 3 months into the illness, that is long COVID. There could be over 200 different symptoms that people can have, and that includes children and infants and adolescents and adults.
Okay. So we're about to get some lived experience here, but before I switch, and you're going to come back on this, how many doctors are seeing patients for long COVID specifically in Atlantic Canada?
As of specialists, right now, I'm the only person seeing long COVID in Newfoundland. And in Atlantic Canada, there is not very many physicians dedicatedly looking at long COVID, but I'm training the next generation of physicians, and some of my newer physicians who just graduated would be very much able to treat long COVID.
Okay, so you're the only specialist in this province.
Right.
And there might be a couple others in Atlantic Canada, but your job now is you're training specialists for the next generation.
Sure.
So this is the jumping off point. So folks, pin that part of the conversation for later in the show. Towards the end, we're going to dip back into that for a little bit. So what we want to do, we've got the definition of long COVID, we've got some of the statistics you just mentioned. So let's bring Stacy in now for this conversation, and we'll get some lived experience. So through this show, come on over. Through this show, what we're going to do, like I said, we're getting some medical references, right? Some understanding of long COVID, and also some lived experience. So just give us a bit more of an introduction on yourself.
Hi, I'm Stacy Alexander. I live on the West Coast, so I'm living in Corner Brook, and I was previously teaching physical education and in the library part-time. So I'm no longer doing that, and I really miss it. Go ahead.
When did that happen, the transition from you teaching like that, catching COVID, and beyond?
So I got sick in early 2020. So this was before our government was even saying that COVID was here. It was January, February, our whole school was sick. Everybody was sick. And I did reach out to public health, but no one really followed through because we had such large absenteeism. It was alarming. And I think at the time I had spoken to multiple different teachers in staff room, and we had 5 children who had been hospitalized with what was like a Kawasaki syndrome-like illness, right? Yeah. Fever and seizures. Which was alarming. So, but I actually didn't think that I was that ill when I did get sick. I had gotten sick, it was about 5 days, and then I felt okay, went back to work, and then it started again. I was like, I think less than a month, I was back at my doctor again. We were trying to figure things out. I was put on some really strong antibiotics to try and, and we didn't have any testing at the time, and we weren't even talking about COVID, so we didn't know that that's what it likely was, right? Yeah. And then from there, once everything shut down in March, I was not, I didn't really notice any lingering symptoms other than like your basic cold things, like your stuffy nose, things like that. But it was about a month later that I started having night sweats and neural itching, paining in my ears, swollen lymph nodes, hives, all kinds of things. I lost a bunch of hair. It was, I think in the run of a year, I had about, I think I counted it to be about 178. It was just under 200 symptoms. It was, because I remember going through a list that Patient-Led Research Collaborative had posted of the 200-ish symptoms, and I had almost all of them checked off at one point, right? But
that must have been really scary.
Yeah, and the problem was that they were so fluctuating. So one thing would happen, and then it would go away, and then another thing would happen, and then it would go away, and everything seemed like very disjointed, and it was hard to make those connections. But when schools opened up in September, I was able to go to work for the first little bit. I guess when schools were online, I was pacing naturally, so I didn't actually have I had lesser symptoms, but when I got back into phys ed and all the movement, and primary elementary school, you can't really stay still. No, there is you're a go from the minute you get there until you go home. And then it really started to catch up to me by October, to the point where I was having symptoms of like brain injury, and like my blood pressure was crazy through the roof. So I would be teaching phys ed, I'd be skipping with the kids and just doing basic motor skills, and I would lose my vision, and that's I guess what I was experiencing was postural orthostatic tachycardia syndrome, which is POTS. So some people, like when you stand up too fast, you lose your vision. But I mean, if I was doing those movements with the kids, because I was going from skipping to then crawling on the floor, and those like up and downs that caused me to black out. So, it worked it was an environment that I really was not, it wasn't working, right? So I had to go on like accommodation of lesser hours. So then I started working only 75% to try and make it work, but my sick leave just dissipated.
When did you get clarity on what was going on with you?
I think it was September, October, around when it got really bad, when I went back to work. A friend reached out to me and she said, Stacy, have you looked into those social media groups on long COVID? And from there, just, I was reading posts and saying, oh my goodness, that's what's happening to me. And this person's having this too, and this person. And it was just people all over the country and everybody talking about how no one believes them and how like frustrating it is and what can we do. So that's where it started, and when I really realized.
And watching it as it was happening, right? So as we're going through reporting in the pandemic, you're just seeing these conversations, seeing people talk about it, seeing reporting kind of come out through different sources on it as well. We've got a full house today. I could easily talk to you for the full show, but what is something you want people to know about long COVID from someone who's been living with it, from someone who has lost a lot of what was important professionally and life-wise for just your day-to-day?
Well, I want people to know that it can happen to anybody. it's cumulative in nature. If you felt fine the first time you caught COVID, you might not necessarily be fine the second time or the third time. And I think a recent study in pediatric long COVID was, and I'll send you the study later
Sure.
so that you have it, upon reinfection. So for children, their risk of long COVID doubles with the first reinfection.
Yeah.
So, it's not the same amount risk tolerance that you're getting the first infection. It's going to be a bigger chance the next infection. And I think right now in Newfoundland and Labrador, Dr. Moriarty from the University of Toronto, she has recently estimated that 1 in 48 Newfoundland and Labradorians have COVID right now. So I want to thank this conference for the Long COVID Web for making this an accessible event, asking people to mask, because people don't realize how hard it is to go through your day-to-day, asking people to accommodate you consistently, right? And I'm really thankful that you're taking the time to do this story today.
Very happy to be here doing this story, talking to everyone. Stacy Alexander, thank you so much
Thanks.
for this. So, start with the doctor. We went with lived experience. Now we're going to come to another doctor here. It's going to be in and out with lived experience and doctors through the whole show. Dr. Angela Chung is here with us now. Hi, Doc. How you doing?
Pretty good.
Tell
Hi.
us. So we went through a pandemic. We learned, like 2020, we learned what COVID is, and long COVID comes into the scene. So as a researcher, as someone in the medical profession, when did you start to be like, oh, long COVID, and how do you get into researching it?
So I'm an internal medicine specialist, and I work in Toronto. And so around the time of January 2020, we start seeing COVID patients. And so this is a little bit before WHO actually called it a pandemic in March. And so I was doing acute care, seeing these people, but I was also running a clinic post-discharge. And I was seeing people with lingering symptoms. And so when the pandemic was called, we actually started a study called CanCov. So this is a government-funded study across 18 sites across 5 provinces. And we studied COVID-19 in the critically ill patients, and then sort of the hospitalized patients, but not in the ICU, and also non-hospitalized patients. So it's across the severity of illness. And we quickly learned that it's not only the ICU patients who are not doing well, even the non-hospitalized patients weren't doing well. So initially the study was only going to study 3 months, 6 months of the non-hospitalized patients. And then we figure, oh no, they're not back to their normal state. They're still unwell. And so we extended it, and we have been doing like a 3-year, 5-year type study across Canada.
So then what are you learning now for where we are now, for what we know about long COVID? What's what knowledge do we have on length and impact and possible treatments?
So we have learned a lot. There's a lot of science, and I would say the science spills over to other conditions as well. So not just long COVID. We do know that long COVID affects, or the virus itself, SARS-CoV-2, affects every single system. So that's one thing we learned. And we also learned that it actually causes lingering issues. And so I think now is the sort of like 2025, 2026 is where you will see the trials testing different therapies coming up with results. So it's actually an exciting time. I don't think we'll have all the answers by next year, but it's moving faster than the HIV days. So I was at the beginning of the HIV pandemic in my medical career, and I can tell you, I see some things that really reminds me of the early days of HIV.
Like what?
The stigma, and the sort of the difficult access to care, and the understanding about exactly what it can cause downstream from the acute infection as well.
so you're talking about being optimistic because of what's coming with the learning and funding and all of that. But at the same time, we're having a conversation where you're saying, well, stigma, is it frustrating that we didn't learn more lessons from the HIV/AIDS pandemic to be where you are right now?
I think we actually have to learn and relearn a lot of things
Okay.
in medicine, but we can, even though we don't have a cure, we can actually have symptomatic treatments that we borrow from many other conditions, and they work. They are quite helpful for our patients.
What should folks know? Is there anything? What should we be doing about our behavior in society for understanding this, understanding folks who are living with it, and all of that? For regular folks who perhaps have not kind of encountered it yet, or know that they've encountered it yet. What should a takeaway be for people?
I think there are many. Yeah. I think there needs to be better general understanding of long COVID, because sometimes when your friend disappear from your social network, maybe they have long COVID. Maybe that's why they don't go to church anymore, or they stop attending your gatherings or whatever. And so some understanding of the disease is important. And also, as you heard from Stacy, the more infections you get, the worse it becomes. And so, some people don't have long COVID with their first infection, but they can get it in the second or third. And so even though I've been running a clinic since January 2020, and the pandemic is over, I'm seeing new patients every month, patients who actually got COVID more recently.
How do we protect ourselves from this?
So masking, and that's a cultural thing too, right? In Asia, people mask. For if they are slightly unwell, they mask. If they are going out in a busy place, they mask. And so this is even before pandemic. Yeah. And so I think masking, good ventilation, it's important, and vaccination as well. Okay. And the common sort of discussion is if you don't get COVID, you don't get long COVID.
No. Dr. Angela Chung, thank you so much for
this.
Thank you. Appreciate it. All right, so there you go. That's that broad research level from the University of Toronto for understanding where things are, what's on the horizon for possible treatments. Let's zoom into someone who's just come through Memorial University's medical school. Selena Zhao, how you doing?
Hi, great. Thank you for having me.
Tell us about yourself. I gave you such a poor introduction there. Please do a better job than I just did.
No, yeah. My name is Selena. I'm an internal medicine resident in my second year here at Memorial. I did my undergrad here. I'm through and through from St. John's, and yeah.
Why internal medicine for you?
Yeah, well, growing up, I was always a curious child, loved learning, wanted to know all the answers. So medicine was a great fit, but specifically internal, I would say it's quite an exciting field. It's constantly changing. There's new research being done in various fields every day. And there's such a variety of pathology. I mean, there's so many subspecialties in internal medicine itself, but within each subspecialty, you can see endless number of different diseases. And so I would say it's the constant learning, but then also the impact of some of the treatments on patients' lives that drew me to the specialty.
So as someone who's at the beginning of their career, what's it been like interacting with patients with long COVID, and just to think of the first 1, 2, 3, 4, and just you thinking of all your training and your learning, and then you've got folks in front of you and you're listening and hearing from them about the impacts of long COVID. What's that been like for you?
Yeah, well, it's been, ultimately a completely new experience. Going through medical school, this is a new disease. We weren't taught about this. So really it was in the last year I've seen a few of these long COVID patients. And I remember the first patient I saw, it was someone consulted to us from the emergency room for admission because of just abnormal blood work from dehydration. And it was my first time seeing how severe and how long-lasting some of the impact that COVID can have. Before then, I saw critically ill patients with COVID, and then me myself lucky enough to get COVID and go back to baseline for after a few weeks, but for them, it's been years and years of repeated ER visits and hospital admissions, and that was, and also just hearing people's stories at the conventions here now today. These are normal functioning people, and then they get COVID and their whole world is upside down. And so to be able to see these cases and then kind of learn as this new science is coming out and implemented in my practice, I say that's quite special this time with this condition.
So in March of 2020, were you in medical school yet?
Yeah, we just started. We
Just
started
started.
medical school online.
So
Yeah.
what's it like to have started medical school online in the pandemic and then to go through and now be someone who's a resident,
Yeah.
on track to being a doctor, looking into this brand new field of study of something that didn't exist not that long ago?
Yeah, I mean, the world is a crazy place.
Yeah.
Yeah, it was 2020 doing Zoom school. You spend your whole life dreaming of medical school, and then when it finally happens, I mean, I was still really excited, but it was nothing that I had thought it would be. But it just quite a unique time. It was also quite isolating, and then when we got back to being in person, I would say like slowly things fell into place, and now going through residency, just learning about COVID. It's really a condition that not only lingered but has grown stronger and with like longer, more difficult lasting impacts, like people with long COVID here now today. So certainly, I think during my training, I have much more to learn about this condition, and but I'm just grateful for opportunities like the symposium here now today to get more understanding of how this disease functions, how to work this up. I think that trainees should really be more aware of this condition, because we will be the ones, in the next few years, these patients, we will be seeing them in our clinics, and hopefully as more treatments come out, we'll be implementing them more and to be able to help our community, people of our community function better.
Well, especially at a time when there's not a whole lot of knowledge within the medical community even when it comes along COVID, and you're here at this point learning and soaking it all in. I just want to say thank you very much for coming on the show.
No, thank you for speaking to me.
All right, Selena Zhao there, internal medicine at Memorial University. We're going to bring Beth Wood into the conversation now. So again, it's that dance back and forth, right, between we've got medical specialists, folks who are researching, and also lived experience. I'm Adam Walsh. This is The Signal. We are live from Signal Hill campus at Memorial University for a long COVID symposium. Beth Wood, how are you doing?
Pretty good, thanks.
Tell us about yourself.
Well, in terms of COVID, I got COVID in February of 2022 at a medical appointment in a place that had really poor ventilation. That at the time, nobody really knew that was an issue. A couple months later, I was feeling really tired, and it was difficult to do my work, and I couldn't really concentrate. It was hard to read, but I just figured, well, it's just a thing that would pass. So, but it kept going on like that, and it got so that when I would climb up a few stairs, I would start to wheeze, and I continued to have these problems where I couldn't concentrate. So I decided I better give up my second job and just have my one job. So I did that, and it kept getting worse. And so I couldn't, by that time, I couldn't stand up for more than 5 minutes at a time, so I had to stop cooking. So I started using frozen foods, which I'm still doing, because I can't stand up long enough to cook anything for myself. So that's been a couple of years that it's been like that.
So you can't stand up long enough to cook?
No. I'm doing better now, so I can put a few things in the slow pot now. But it's been a couple of years that I haven't actually eaten anything but frozen food.
Can I ask you, what's the reaction from family and friends? What's the reaction been like from them for this? Do they understand?
Well, my parents are in their 90s, and so I just make sure that when we're going up the stairs, I'm behind them. So because my dad, who's 92, can do the stairs better than I can. Right. So that's how I kind of manage that so that they don't panic too much. But my parents and my family have been great.
Good.
My employment was a bit tricky when I had to actually leave my full-time job That was a bit tricky for them to understand because they didn't understand what was wrong with me. And now I've had to go through the really torturous journey of trying to get on disability. And the paperwork is just crazy. And when your brain isn't working that great, it's even worse. And a lot of people who have long COVID get turned down when they apply for disability or workers' compensation or insurance that they're entitled to because people aren't familiar with it enough. So it's really a struggle to get, even to live at a poverty level is a struggle to get the supports that are supposed to be available for us. So it's a bit of a rough go, but I'm doing okay.
Yeah. And you're from Halifax?
I'm from Halifax,
Right.
yeah.
And you're here as a lived experience, a patient representative.
That's right,
yeah. So you've got what we just talked about. What else are, for messages, what else are you talking about today that you're trying to deliver to people while you're here, or when you talk about advocacy around long
Well,
COVID?
this morning we heard about children, and that's a real concern that I have. There are a lot of children who have long COVID, and I'm already beyond middle age, and so I feel like I've had my adventures and I've had a lot of fun and done a lot of things and fulfilled a lot of dreams. But when I think about children and young people, they haven't had all that. And there are people who are children who can't be in school. There are young people who should be starting off their first job, should be going off to college, who aren't doing those things because they have the same kind of situations that I have. And I feel very, very badly for the younger people because many, many hundreds and thousands are facing this. And it's just a really rough go, especially when you're young.
You've given us a lot of description about what changed, but for this final question, what has long COVID taken from you, from your day to day?
People. I'm home sitting in a chair most of the day, most days. I go out twice a week, so I don't see very many people. My work, I loved my job.
What was your job?
I was an admissions officer for an Indigenous graduate school, and I had great relationships there and really enjoyed what I was doing. And so I can't do that anymore. I used to be able to spend money because I didn't have a lot, but I had enough, whereas now I live well below the poverty line. And so you miss a lot of things when you can't go out because you can't afford it.
Thank you for speaking with us today. Beth Wood there, everyone. You're listening to The Signal. I'm Adam Walsh. Again, we'll go from lived experience, and let's get some more. Well, this is lived experience with a medical perspective, actually. Dr. Mike Hall joins us on this show. Hey.
Hi, Adam.
Thanks for coming on.
Nice to see you. Thank you for doing this.
And for the radio listeners, which is, I mean, everyone listening right now, except for the people in this room, just to remind you, if we sound a little muffled, it's because, well, we're wearing face masks. We're at a long COVID symposium. Give us a bit more of an introduction on yourself, sir.
So I'm the co-chair of the Canadian Long COVID Symposium. So I was fortunate to be a part of this process, and it's been an excellent experience so far. The amount of information that has been shared through the symposium has been phenomenal.
Yeah.
And so my background, I'm a community-based specialist. I'm a pediatrician, and my interest area is allergy. So I've been working in St. John's for a long, long time. And my other hat, so where do I tie into long COVID? I'm a caregiver. So my wife has long COVID. She's had long COVID for about just over 3 years. So I've been living that with her and helping her through the process of long COVID. And also as a physician, learning about long COVID, the medical aspects of it. So,
what is caregiving? And if there's anything you can't talk about or not comfortable, do not feel like no one has to answer any of these questions if you don't feel comfortable. But what is it like being a caregiver for someone with long COVID?
Well, so a lot of it is at the start is learning, sort of looking at the symptoms. My wife went through a lot of different things initially. She had respiratory issues and cardiac issues, and then the brain fog ensued. And it's a condition that changes. Some days are good and some days are not. So it's trying to figure out, what this is all about. And my wife is very smart. She was in the know, thinking about long COVID. and saw things on social media, and she would say to me, my brain is not working well. I need you to read these articles and sort it out for me as to where all this fits in. So I've been trying to be her right-hand man to try and support her through all this. So, but our life has changed. You know, things that we could do, you know, my wife is very active. We'd always had plans to travel, to do different things, and a lot of this had to change. You know, it changes on the day-to-day things. Some days she's too tired to go out the door, and then she has to rest. And I'm there to say, you have to rest. You don't worry about the house. Don't worry about running around and doing things, which was always her nature. Okay, I'm going to do this, get all this accomplished. And some days she couldn't do it. So your life changes. You make plans for trips, and you say, oh, no, okay, we're going to have to put that off. Make plans to go out. Okay, my gut's not going to tolerate that. No, we can't go out there. So your life just changed, but you're hoping at, you know, as this goes along, your hope is there, is to say things are going to get better. You will get better. Things will improve. You will get back to where you were. But we're living the new norm. So new norm is living with someone with long COVID. Your life changes. So.
When I've done previous shows talking to caregivers, whether it's shows about loved ones with dementia, whether it's shows about folks who are married to folks in long-term care, the thing about caregivers is that they also need support. How are you doing with, like, what do you do for your own well-being and support when you run through this?
Yeah, so like to me, I keep thinking, I don't have long COVID.
Yeah.
And so for me to be able to walk out the door and I'll say, I'm going to go for a walk around the lake and go for a walk down the trail because I know I can do it and she can't, right? So trying to do those self-care things is important, right? I get a good night's sleep. I don't feel exhausted during the day. So I'm able to go in and say, okay, I can cook supper tonight. Not a problem. I'm happy to do it, right? Yeah. And I feel good because I can contribute from that point of view, right?
What do you think is not being emphasized enough about long COVID?
I think people think it's a rare condition. It's not rare. You know, you're talking about 1 in 5 people have long COVID, and it's increasing over time. You know, COVID never went away. People think that it's disappeared. It's no longer an issue that we should be concerned about. COVID continues to happen, and with that, there's a percentage of people who are getting long COVID. So really, we're seeing more and more cases of long COVID. So that's one thought. A recent study in a prominent medical journal looked at long COVID in children, and their end comment was, the most common chronic illness in children is no longer anxiety or ADHD or asthma, it's long COVID. And from my hat as a pediatrician working in the community, I'm thinking, okay, there's a lot of children who are coming into my clinic and they likely have long COVID, and I need to be aware of that and look more into that and spend the time to sort that out. More to acknowledge the fact that these kids who are tired and can't go to school and they're not sleeping well and they're anxious and they're feeling down and depressed, to acknowledge the fact that despite all these normal tests that you have, just to say, this is long COVID that you have and your children. So just to acknowledge that. Currently, when we look at treatments, you know, there's so much hope now about new treatments going to help the disease, to help treat long COVID, but we have nothing that's currently approved as a treatment. So the current guidance should be prevention. COVID still exists. So in order to prevent long COVID, you should try and prevent not getting COVID. And the way you do that is the same message that we've had for 6 years. Get your vaccine. People think that they no longer need COVID vaccines. COVID never went away. You should get your vaccines for yourself, but also you have to protect your children. So you have to think about saying, my children need the COVID vaccine as well. And it's the same thing with ventilation and masking. Masking works. You know, knock on wood, I will not say anything. As far as I know, I've never had COVID. But I have masks wherever I've gone. I mask at my work, my patients mask. When I go to Costco, I put on a mask. When I go to Sobeys, I put on a mask. I sometimes is the only man walking around in COVID with a mask on. And people recognize me. Dr. Hall, how are you doing? Because they know me as a mask. But for me, it works. It protects me from getting COVID with the risk of long COVID. And it protects my wife because I can't get COVID because she has long COVID. And I have to protect her. So.
Thank you for sharing all this.
All right, thank you.
Dr. Mike Hall. Rebecca Lukowitz is here. Like so many people, I'm looking around. Hi, Rebecca. Thanks for coming on.
Thank you for having me.
Tell us about yourself.
Okay, so I have 2 children. I'm a person with lived experience because my son is 14 right now and he has long COVID. We have 2 kids actually. So my daughter's 2 years older. My son, our family used to be very outdoorsy and love being active. And Ethan has had long COVID for the last 3.5 years now. And it's taken a huge turn on in terms of our life and what our life looks like now. So because of his experience, I've become an advocate for children in Canada that have long COVID.
What was the difference from family life before and into now?
Huge. So before Ethan got sick, there's a before and there's an after.
Yeah.
Okay. So Ethan got his first COVID-19 infection at the end of April of 2022. Before he got sick with this infection, like our life was outdoors, hiking the trails, swimming, camping. Ethan was playing hockey. He was training in mixed martial arts, excelling at school, had tons of friends. Family life was very good as well, like lots of family activities, like outings, get-togethers. Yes, it was pandemic, so we took precautions.
Yeah.
But we still got out and we still enjoyed our life and made the best out of it. And these are the earlier days of the pandemic. The after was very different. So he came home from school one day at the end of April of 2022 with a bit of a sore throat, a bit of a runny nose, barely sick actually. And 2 days later, he was pretty much back to asymptomatic again. But the rest of us had caught whatever he had. All to varying degrees. But Ethan was the least affected out of all of us. He had the most mild case of COVID-19. But about 2 weeks after that, he started complaining that his tummy was hurting. So tummy pain infrequently, then it became more frequent, like 3-4 times a day, then about 6 to 8 times a day. About 2 months into this experience, we didn't know what we were dealing with. He'd be waking me up in the middle of the night crying, "Mommy, please take my tummy pain away, it hurts so bad." So this was the beginning of our journey, and the life completely changed. We didn't do anything anymore as a family outdoors. For the first year of his illness, we basically stayed home hoping one day he'd feel a little better so we can do stuff. And we came to realize that we have 2 children and our other child still has a childhood to have. So we need to start splitting up and doing things, it's essentially like a broken family. So my husband and I have a great relationship. We've got 2 amazing children that we're very close. And one of us parents was doing one thing with one kid outdoors. And the other parent was sitting with Ethan on the couch when he's sitting there in pain and not able to do the things he used to love. So very, very heartbreaking and complete 180 from what our life was before.
I mean, for 2 parents to navigate those discussions and to figure all that out, that must be awfully hard.
It was, but not so much. I think the hard thing is not being believed by the medical system. And it's not necessarily anyone's fault per se, but this is so early in the pandemic. But unfortunately, still to today, we have clinicians not understanding what long COVID in children looks like. So the hardest part wasn't what we were navigating, it was actually trying to access care and trying to be believed. And so, the heartbreaking part that really pulled us apart as parents was having Ethan being told, "You must be an anxious child. There's nothing wrong with you. Are you school avoidant?" And he's had clinicians say to him, "Hey, buddy, are you being bullied at school? Is that a reason you don't want to go?" And he's like, "No, my tummy just really hurts." Yeah. And it's challenging because, I know my child, and I know that this wasn't the way he was before, and something major changed after that infection. But I didn't even attribute it to the COVID-19 infection. I just knew something was different. And I think the hardest part was so challenging was the first 13 months of his illness. Because I always say, it only took us 13 months to finally be believed. 13 months in the life of an 11-year-old child is huge, but only 13 months. Why do I say that? Because I know as an advocate now that we have children that are 2, 3, 4 years into long-term symptoms that are consistent with long COVID, and they're still not being listened to, still not being believed. And parents are heartbroken and literally destroyed because they don't know how to get care for their children, and they just give up, and so this is why I advocate, and this is like I took that pain and that heartbreak and I made it into something positive, which is to help all children that are suffering in Canada, because I've lived it, unless you live in my house under my roof hearing the cries of your child saying, my tummy hurts so much, please help me, you wouldn't understand, It's been very hard.
I'm so sorry for what you and your family are going through. The advocacy you're doing, do you see differences that get made when you do this?
I mean, I'm still in the early days of my advocacy as an independent advocate.
Yeah.
And I'm here for Long COVID Web, working not as an advocate, but part of the organizing committee. But yes, definitely advocacy makes a difference. But it's not one person as an advocate, it's a team of people that are willing to collaborate and all work together to help support, whatever changes we need. So we need people that are actually wanting to come out of the shadows as people with lived experience, with parents of sick children, of other people with lived experience like Beth and Stephanie, who you had before, and actually start advocating and speaking up, because not everyone that has long COVID has a voice. Some of them are too sick, some of them are not comfortable sharing. In the world of pediatric, with long COVID in children, there's a lot of parents that wish they could do more, but they don't have the capability. They don't have the capacity. And I think that's the difference. I think for people that have children, these children's voices are not being heard, and the caregivers are not able to speak either because they're not comfortable, or maybe they don't want to share because it's very private, or maybe they're not being believed by their family members and there's a stigmatization. In my case, that's my only way that I can see moving forward to get care for all Canadian children, is by speaking up and actually raising that awareness.
Is Ethan have an okay week this week?
No, he never has an okay week. So Ethan actually had his first infection back in April of 2022.
Yeah.
He learned to cope with the chronic abdominal pain and the chronic nausea, and went for rehabilitation. He was very lucky to have access to that. Regained function, went back to school all day, every day, went back to playing hockey, asked to play in a hockey tournament. He caught a second infection at the tournament. With people that have long COVID, we know that reinfections make them sicker. And within 2 days of his reinfection, his pain flares were through the roof, even worse than with normal colds. Swabbed him again, he was positive, and since then there have been no more good days. Okay. So by April of 2024, we realized that we're dealing with something that we have no idea, and we didn't even know he had long COVID at the time. He ended up hospitalized at Sick Kids for a week, and despite what they did to try and help with some of his other symptoms, he felt no better when he was discharged, and that was the point where it was recognized that this is long COVID. So really, it's only been since April or May of 2024 that I've come to terms with this is what my son has, and it's hard.
When you hear about some of the stuff that's coming on the horizon for treatments, does any of that offer any bit of hope or anything?
I mean, hope for adults, yes. For children, not really, because a lot of the treatments for symptom management, in my case, there's a lot of treatments that we don't call them treatments per se, we call them symptom management strategies, right? Yeah. That's more appropriate. We don't have treatments, we don't have a cure for long COVID, but there's lots of symptom management strategies that are really, really effective. In Ethan's case, nothing has worked to date. He's exhausted all options within the Canadian medical system for treatments that potentially can help, symptom management strategies that can help with alleviating his abdominal pain that's there all the time, and the nausea. So I'm excited to hear what's coming out, and I'm excited for a lot of long COVID sufferers in Canada, adults and children. But in Ethan's case, I think there's going to be it's going to be years before he gets care. The other problem is, we talk about adults, there's access to care, not a lot. Our funding is not there by the government to provide that care, but there's a little bit, and they also have access to clinical trials, which gives them hope. Children in Canada have no access to clinical trials because of ethics board approval. There's a process for that. So, Ethan's 14 and a half. If there's new treatments that come on the horizon that have clinical trials, these trials are open only to adults. Ethan's got to wait 3.5 years. He's already been sick for 3.5 years. He got sick when he was almost 11. That's half of his life waiting. And this is a child that lost his childhood already. It's very hard for him. It's very heartbreaking for us. And what do? We just sit and wait. So that's the challenge. And I think I can echo a lot of people that have long COVID. Symptom management strategies can't come around soon enough. But the only way to get support is not only symptom management strategies, it's having clinicians come into place, being funded by the healthcare system to come into place and provide the care to these patients and be there as providers to provide symptom management strategies. We don't have that. That's a problem.
Rebecca, thank you for sharing this today. I appreciate it.
Thank you very much. Can I add one last thing?
Yes, of course.
And really important. We did the numbers recently because we know as of 2023, there's 3.5 million Canadians that have long COVID. We do not have a direct number of long COVID in children. But what I wanted to add is this really important point. Metrics are really important for key stakeholders. In the US, we know there's 6 million children that just came out as part of the JAMA, Journal of American Medical Association paper. 6 million children. If you do a correction based on population, us advocates, me and another advocate, we estimate there's about 600,000 Canadian children that have long COVID.
Right.
And that's a number that's probably from 2023 based on all the other recent, data that's come out. So like this is not a small number. This is more than 500,000 Canadian children that have lost their childhoods, that have lost support. And it's not only that, but it's not only their medical care, but it's their education in the future, right? So they need care.
Thank you, Rebecca.
Yeah, thank you for having me.
Rebecca Lukowicz there. I'm Adam Walsh. This is The Signal. We're getting down there on time, but we'll bring our next guest up. We're at a Long COVID Symposium, the third Canadian Long COVID Symposium at the Signal Hill campus at Memorial University. Dr. Catherine Clark joins us now, family physician. Doc, thanks for coming on the show. How you doing?
I'm good. How are you doing?
Good. What's it like being a family physician in this province? Well, I mean, there's a bunch. We could do a whole show.
That's a loaded
actually,
question.
A whole separate show.
Yeah.
But specifically when it comes to long COVID, what you've been learning and seeing, talk to us about that lens that you have.
Yeah, I mean, it's difficult right now. There's no doubt about it for several reasons. So I think with COVID and long COVID, there isn't always a buy-in with everyone even believing that this exists. So I think it's really important that we're doing the symposium and speaking out about it, because I think we just need to bring awareness to this diagnosis and have people think about it on their differential. I mean, I was talking to a colleague and I said I was coming here to talk at this symposium, and she said, geez, like I don't even think about that anymore. So I think there's a bit of out of sight, out of mind with COVID now.
That sounds, if it's a colleague in the medical community, I mean, that sounds problematic given what we're hearing and what you know from being, like, if people aren't thinking of, if doctors, family doctors, or nurse practitioners, or anyone else within the system doesn't think about this, what do you think about that?
Well, it makes things difficult because then when you're, going to your colleagues looking for help, people are getting misdiagnosed. This is getting missed a lot, and it's definitely underdiagnosed for sure. Not to mention just the pitfalls of the medical system right now, and how difficult it is to really get any imaging, get people seen in a timely manner for the referrals. It's all, we're in the trenches right now.
So if I go to you, like let's say this afternoon, I'm in front of you, you're in your office, I'm like, Doc, I'm not feeling good, I think I got long COVID, or I don't even know. What's the process and how difficult is it? Or if it's not you, if it's someone else, what are the barriers here to getting treatment for long COVID in Newfoundland and Labrador?
So as a family doctor, you're probably booked in for a 15-minute appointment, right? Yeah. Most people are coming in with their long lists because of just how the system works. No one's coming in with a runny nose anymore because it takes so long to get seen by other professionals. People are sicker when they're coming into their family medicine or to their family doctor, so that's a problem. But long COVID has so many different symptoms. Like there's 200 symptoms, right? Or more. And all the symptoms are pretty broad. So I think it's a bit of a diagnosis of exclusion. So you really need to work patients up and get their blood work, get their scopes, get their pulmonary function tests, whatnot, back before you can be sure that it's from long COVID. And that all takes a really long time.
A long time. And that's if they have a family doctor.
That's if they're lucky enough to come see me, yep.
And not even a family doctor who has an understanding and doesn't think the pandemic is completely in the rear view mirror like a lot of people feel it is, someone who's actually thinking about it. So if they don't see you, and they see a family doctor who doesn't think about this, what happens to them?
They're getting misdiagnosed and they're falling through the cracks.
And what does that mean?
Well, we're letting our patients down. Yeah.
So what needs to change in Newfoundland and Labrador for an understanding around long COVID, around treating it? And I mean, yes, we could go to the health accord and what's going to happen with that and changes and everything else, but just specifically for this, what has to change?
I think we just need to bring awareness. I think that's the biggest thing, is just reminding patients or physicians even that long COVID isn't over. It's still out there. You need to think about it. You need to have it on your differential so these people don't fall through the cracks.
Do we hear enough from public health in this province about this?
I don't think so. No, I don't.
So what messaging do you think should change?
I don't know the answer to that. I think we need to be able to advocate a little bit better, but how can we do that? I'm not entirely sure.
No, but like you said, it's about folks learning talking, communicating, understanding, and if that goes across a system, then you might get a doctor who may not be thinking about it, maybe after talking to you or hearing about a symposium like this, maybe it is somewhere there in their thoughts to start looking for it a bit more, and that can be helpful.
Absolutely.
Thanks for this.
Thank you very much.
Appreciate you coming on the show.
Thank you for having me.
All right, Dr. Catherine Clark there. We're really getting down there. We'll bring Dr. Anise back in to... You're the only specialist for this province. You're training others, right?
That's right.
What's a takeaway? What's something,
Sure.
a thought to leave people with today?
Sure. So again, thank you, Adam. So as you already have heard the message repeatedly from physicians providing care, from people with lived experience, I think the biggest message is there is a lot of medical gaslighting. People are either simply not aware of the research or choose to ignore it. I think it's the former. People just don't know. People have not been educated enough. So that's what I'm doing. And that's why I'm very thankful to Dr. Chang and Long COVID Web to let us, this is a third annual symposium, a Canadian Symposium on Long COVID. We have an absolutely phenomenal lineup of speakers here today who are talking about exact science and showing that this is not a disease in people's head. This is an actual disease. And I can tell you, in Newfoundland, the patients that I care for with long COVID have been police officers, teachers, nurses, doctors, and respiratory therapists, the first responders. Every single person. I have people who are doing 16K every day who cannot walk on level ground. These people are not faking. It is not in anybody's head. People have to be believed. The first message for physicians, any physician, whether it's a family physician or a specialist, is to believe your patients. And then the next step is, if you don't know about it, learn about it. That's why we brought the symposium here, to raise awareness. Secondly, personally on a different basis again, because I have funding from Long COVID Web and Health Canada, CHIR, myself and a physician from British Columbia, we have a monthly ECHO session. ECHO session is to educate healthcare providers about rare diseases, and this is for long COVID. When you have a disease that affects the masses and you have to, in a hurry, train a large number of healthcare providers, family physicians, nurses, allied health, so we hold a monthly free of cost webinar online, open to all Canadian healthcare providers, which we bring a specialist who gives a 20-minute talk on one of the long COVID topics, and then we discuss a complex long COVID case and provide evidence-based suggestions as much as evidence is available.
We've got about just a minute. So for Andy in the studio, we're going to go to theme. We won't go to the song at the end of the show here. Pike, when we get down to 30 seconds, just give me a wave here. Dr. Anise, if someone out there, and add whatever else you want to this, but we've got less than a minute. If someone is thinking they might have long COVID and has not been heard by a doctor or not believed, what's your advice for them?
So they can go to Long COVID Web, which is an excellent evidence-based free resource for resources for help, where they can find information, how to go about it, and they can, if they are fortunate to have a family physician, tell them to use that resource. There's CAN-PCC guidelines, which are Canadian guidelines with a lot of effort that can guide people where to start, healthcare providers and patients. Thank you very much for having us today.
Dr. Anise, thank you so much.
Thank you.
That's it for the show today from the third Canadian Long COVID Symposium on Signal Hill campus for Memorial University. I'm Adam Walsh. This is The Signal. Thank you for listening. We'll do it all again tomorrow. Cheers.